What are the factors involved in diagnosing osteogenesis imperfecta?
There may be a purely orthopedic manifestation of a genetic disorder, such as, let us say, osteogenesis imperfecta or so-called brittle bone disease, where the bones themselves tend to have very easy fractures. So even with most trivial injuries, the bone tends to break. By and large, this problem is more common in childhood, and the affected child, as the child grows up, tends to become less and less susceptible to having fractures. And typically, by the time they're adolescent and adults, that tendency generally peters off, and they tend to become more stable and less likely to have fractures. So this is one example of an essentially orthopedic genetically determined problem. But there are orthopedic coincidences. So, for example, if you take a whole lot of hematological problems like thalassemia, they have orthopedic manifestations simply because their problem, which occurs in the bone marrow, renders the bone slightly more easy to break. Because of the higher turnover that's going on in the bone marrow, they have a greater tendency for the bone to become softer and a tendency to break very easily. And of course, because let us say in thalassemia, there is a large deposition of iron in the bone, it tends to slow down the way the bone remodels itself, heal itself, and that interferes with the way the bone behaves over a period of time. So, this in a nutshell should uh, help us understand that dealing with bone related problems in the sort of sphere of genetically predetermined diseases need not always be purely orthopedic issues. It may be orthopedic coincidental issues as well. Specifically of osteogenesis imperfecta. Osteogenesis imperfecta has got multiple types, of which the most common variety follows this pattern. The most uncommon variety, thankfully, is unfortunately more or less lethal, in the sense it does eventually result in a very early end to life of the child. So that variety, thankfully, is very, very rare and uncommon. The more common variety uh, is the variety where the child has fractures with, as a toddler or even as an infant, the child rolls over, has a small trivial fall, sustains a fracture, is brought to the family physician or the pediatrician. They recognize that the child has a fracture. The fracture is treated, maybe with an orthopedic surgeon. And then again, the child has yet another fall for probably no significant reason. The bone breaks. So when this sort of a history crops up, the pediatrician or the family physician or the orthopedic surgeon involved definitely start looking at the concept of osteogenesis imperfecta.